analysis for committee members that we can look at. But what I'd like to do is devote some time at the next hearing to inviting some folks to come in and talk to us about what's in that bill, and specifically looking not at all of the bill, but the elements of the bill where the federal government is providing funding potentially to states to do various things that fall within the ambit of this committee, and then what we need to do to best position ourselves to take advantage of that funding. In some cases, we'll have the capacity to take advantage of the funding. In other cases, we may not have the capacity to take advantage of the funding, but I think we need to go through the exercise of understanding what's in there and make conscious and deliberate decisions as a legislature as to what things we want to avail ourselves of and what we may or may not be able to avail ourselves of. So with that, we want to welcome the Emergency Medical Services Authority, and the floor is yours.
Good afternoon. I'm Dr. Steve Barrett, Director of the Authority, and I have with me Lisa Schoenthal, my Deputy Director of Emergency Response Division. So we're here today on item 4120, the Emergency Medical Services Authority. We are the department responsible for coordination and integration of emergency medical services systems throughout the state of California. We accomplish this primarily through three divisions, one of which is our personnel division, which is responsible for the licensing of paramedics throughout the state, as well as their regulation and discipline, coordination of emergency medical technicians in the development of the Emergency Medical Technician Registry, which is a requirement of AB 2917, which we'll be talking about later in our presentation, and then coordination of our disaster medical health response through our hospital and out-of-hospital emergency medical assets. We accomplish this with approximately 68 people and a budget of just over $24 million.
Very good. Well, thank you for that overview. Why don't we move now to the first issue, issue number one, which is the Emergency Medical Technician 2010 project, and ask if you could provide us with a presentation on that item.
The EMT 2010 project is the name given to the implementation of AB 2917 from 2008, which is a process to standardize the certification process of emergency medical technicians, which is currently done by just under 70 local certifying entities in California. This process will require a standardized background check, a criminal background check, as well as standardization of the application process. Integral to this is a central registry, which will for the first time centralize at the state the number, location, practice parameters of the emergency medical technicians and allow us to access them in a rapid manner in the event of a disaster through our disaster healthcare volunteer system. This is a fee-based program based on the certification fees charged to emergency medical technicians. And the process that we are requesting in our budget is adjustment, basically to provide the background, the positions, permanent positions to handle the IT components, and then the coordination of the certification process, so it's standardized through the certification entities at the local level.
Okay, very good. Any comments from either the Department of Finance or LAO? Okay. The staff recommendation is to approve the request. Seeing no further questions from the committee, at the appropriate time when we have a quorum, we'll ask for a motion. Let's go to issue number two, please.
Issue number two was the adjustment of our paramedic licensing activities and fee adjustments. One of the provisions of AB 2917 was to move the fee-setting process for paramedics from statute to regulation. The paramedic fee had not changed since the Emergency Medical Services Authorities assumed responsibility for licensing of paramedics in 1994. At that time, there were just under 7,000 paramedics in the state. Currently, there are just under 17,000 paramedics practicing in California. The adjustment in the paramedic fee structure is to provide for the administrative law process, enforcement process, which has increased with the almost tripling of the number of paramedics in the state. The fee adjustment is a 2-year fee adjustment. We are bringing that in at $35 per year over the next 2 years, and this is just adjusting to bring on the additional 3 permanent employees to review process, or not 3. I'm sorry, one additional employee.
So one employee.
Mm-hmm. We currently have 3 in the division right now.
So you're going to go to 4?
We're going to go to 4.
Okay. Any comment or Questions from either the Department of Finance or the LAO? No questions from the committee. The staff recommendation is to approve at the appropriate time. We'll ask for a motion accordingly. Issue number 3, pharmaceutical cash for mobile field hospitals.
This is a request to increase by just over $400,000 out of general fund stabilization of our pharmaceutical cash for our mobile field hospitals. Currently, California has 3 200-bed fully mobile field hospitals. You can think of these as basically hospitals in a box, ready for deployment throughout California. They require, obviously, in addition to the facilities, they require pharmaceuticals to care for patients, and this is a fairly extensive pharmaceutical list that covers the things that you would expect a full-service 200-bed hospital to be able to care for. When these hospitals were funded in 2005, the amount of pharmaceutical maintenance was underestimated in the budgeting process, primarily due to the expiration of the pharmaceuticals. So we've been exploring several options in an attempt to provide for stable in-date pharmaceuticals for the process. The budget request here is for EMSA to maintain basically an insurance policy with the pharmaceuticals. These would largely outdate with their natural expiration, just simply because of the frequency at which these hospitals are deployed. We have never deployed a hospital in an emergency situation since 2005. What my staff is exploring with now is the opportunity to have a pharmaceutical source, a state preferred pharmaceutical supply house, basically procure and maintain for us these pharmaceuticals that could be the drugs could be rotated. We're still in discussion with them, but we're hopeful that we can come to a process that may reduce this estimate by as much as 50%.
When you say this estimate, you mean the additional $448,000 required in this item?
Yeah, we're attempting to get that number down to approximately $250,000.
Based on the discussions you're having with the potential preferred vendor.
Well, what this would be a shift from us purchasing, buying, and stockpiling the pharmaceuticals at one of our mobile field hospital locations. We would have the vendor maintain the pharmaceuticals in their warehouse, and basically, as one got near expiration, put that into their general use and put a new one into our reserved pharmaceutical cash.
So what's the timeline then for your decision making with regard to the utilization of this preferred vendor?
Well, we're actively engaged in negotiation with them right now. We're trying the primary things that we're trying to work out with them now is the availability of the drugs. And one of our main concerns is that if this hospital is deployed, we can have the pharmaceuticals available to us within the 72-hour time frame that it takes to set one of these hospitals up.
So do you anticipate the discussions concluding in the next 3 months, 2 months, 1 month, a year?
We anticipate we should have an answer from AmerisourceBergen, the pharmaceutical wholesaler, within 30 days.
Okay. So that would be in advance, ideally, of the legislature taking action on this item. And conceivably, then, the amount that you're requesting might be lower based on what transpires in those discussions.
That's correct.
Okay. Does the department or the Legislative Analyst's Office have any comment that they wish to make?
Thank you, Mr. Chair. Lisa Morawski with the Legislative Analyst's Office. We have encouraged the department to pursue this lower cost option.
Okay. And we've been joined by Vice Chair Emerson. Do you have any questions, Mr. Emerson? No. Okay. So I think I know the staff recommendation, given the pendency of the discussions with AmerisourceBergen, is to keep the item open and to allow it to be revisited in the May revise, with the hope that we would have more specific cost information, and we want to encourage the department in its efforts to try to reduce those costs based on the utilization of this preferred vendor. So we will, unless there's any objection from the committee at the time that we have a quorum, the recommendation will be to keep this item open. Okay, the next one is issue number 4. Go ahead.
In response to the legislative request from last year that the department search out alternative funding for the regional poison control system in an attempt to leverage available federal dollars to reduce the pressure on the state general fund. We were able to successfully coordinate with the Managed Risk Medical Insurance Board, Mr. MIB, to access federal Children Healthy Families program, utilizing the state general fund resources and matching those with federal dollars. So we were able to achieve a match that was able to maintain the stability of the poison control system and allow them to continue services. So this is primarily spending authority to expend the extended dollars, which are now primarily federal SCHIP money.
So the amount of the grant, if you will, the federal stabilization grant, is a total of $5.2 million according to our analysis, and it's in 2 annual increments, $2.6 million in the current budget year, and then $2.6 million in the next budget year. That's what we have, at least. Is that right?
No, that's not what.
Okay, what do you have?
What we have, we have a total of $5.4 million based on a 65% match, a 65% match, and that the spending authority increase we need is to expend the additional $5.4 million, and then the current year we handle that through a Section 28 letter with Mr. Mid.
Okay, so I'm a little confused. I'm looking at the wrong line item. I apologize.
Okay, there's an additional.
There's a separate grant.
Right, there's an additional $2.6 million that's a federal stabilization grant that is from the Health Services Research Administration directly to state level poison control systems.
I understand. Thank you for the clarification. Are there any comments from the Department of Finance?
Yes, Tom Williams from the Department of Finance. Just to clarify, the SCHIP dollars that are coming from the Mr. MIB program, those are not grant funds, they're federal fund authority. So to the extent that the department incurs cost and submits those invoices for Mr. MIB for payment, they'll draw the federal funds. So if you don't spend the full $5.2 million, it's not lost fund, it's just unused federal fund authority, and then in the next year they can draw up to the amount that they have the authority for expenditure. So unlike our grants or other grant funds, it's not you have to spend it in the current year or lose it.
Well, and what's the duration of time that this funding stream is available to us? Do we know?
Actually, it's at least for the next several years. It was a state plan amendment so technically it's ongoing.
Okay.
They can draw these funds as long as they have the invoices for these. It was the SPA was approved in December of 2009 and goes retroactive back to July. So we did the current year Section 28, and we can go back and claim to the start of the state fiscal year.
And these funds are in addition to funds available under the SCHIP program to fund the Healthy Families program. This doesn't come at the expense of Healthy Families, correct?
Correct.
Okay.
It's similar to like we have the CHIM program where the counties provide county dollars that the state draws federal dollars for and then returns back to the counties. So you're right. It's in addition to what we need for to fully fund the SCHIP, the Healthy Families program.
Okay. Any comments from the Legislative Analyst's Office? No. Any questions from the Vice Chair or other members of the committee? Okay. The staff recommendation is approved, and that will be the motion at the appropriate time. Before you go, let me see if we have any one in the public who would like to testify as to any of these items or anything else related to the Emergency Medical Services Authority. I don't see anyone rushing to the mic. Very good. Thank you for your very succinct and comprehensive presentation, and we'll take a motion at the appropriate time. We're now going to call item 4140, which is the Office of Statewide Health Planning and Development, and ask that the representatives of that office please come forward. And we want to welcome you here and ask if you could please provide an overview with regard to OSHPD, its programs, and budget.
Thank you very much, Mr. Chair, Mr. Vice Chair. I am David Carlisle, Director of the Office of Statewide Health Plan Development. I'm joined by our Acting Chief Information Officer, Deborah Holstein. The department is a department with a proposed budget of just over $102 million for the upcoming fiscal year, and 454 PYs as budgeted. We really operate in four programmatic areas in addition to our administration division. We have our workforce programs, that's the Workforce Development Division and the Health Professions Education Foundation. We have our information programs, data programs, the Healthcare Information Division. We have our very large Facilities Development Division that does seismic safety enforcement and hospital plan review. And we do some not-for-profit financing, providing loan insurance via the Cal Mortgage Program. The department has been around, has been in existence for just over 30 years, and is looking forward to your budget questions.
Very good. So we have first issue, which is Medical Information Reporting System. Wonder if you could provide us with an explanation of this request.
Yes, I'll go ahead and just say a few words, and then Deborah will provide more detail. MIRCAL is essentially a online, web-based reporting system. Just over approximately 30 million observations per year. 16 million observations per year are transmitted to the office via the MIRCAL system. They're transmitted from every acute care hospital, emergency department, ambulatory surgery center that reports data to us, and really shortens the turnaround time between data in and data out and report production for the office since its inception some years ago.
This request is a $0 BCP to convert $443,000 worth of consultant funding to fund 3 permanent positions to support the ongoing workload of the medical information reporting for California system. At the time the system was built and approved, the resources to do this kind of work were very scarce. It was very new technology. Since then, the resources, both in the private and public sector, have grown significantly. The state has offered open tests for IT classifications, and we feel comfortable that we can find qualified staff that would provide consistency in supporting the system. In addition to that, we have over the years gathered a great deal of backload and work that needs to be done, and are hoping to be able to accomplish future work without additional funding.
Very good. So basically you're taking the work in-house.
Yes.
Glad to hear it. Any comments from the Department of Finance? No. Any comments from the legislative analyst? Any questions from my colleagues? The recommendation is to approve. We'll take a motion at the appropriate time. Any testimony from the public on this item? Okay, let's move to issue 2.
Okay, issue 2 is our Saw and Brown program. This is a program that has supported primary care training and education for many, many years in the state of California. Specifically, historically, the training of family medicine residents. Then more recently, family nurse practitioners and physician assistants were added to the portfolio. And most recently, with the focus on registered nurse education, we have also supported registered nurse education institutions. The program does support training institutions, not individuals. And Angela Minifield, the Workforce Deputy Director, will provide more detail on the question.
Thank you. Welcome.
Thank you. And specifically, the Song Brown BCP is requesting a funding shift of $5,039,000 from the state's general fund to the California Health Data and Planning Fund to support the Song Brown program. Dr. Carlisle has already noted that the purpose of the program is really to facilitate clinical training opportunities for family nurse practitioners, physician assistants, registered nurses, and family medicine residents who practice in health profession shortage areas.
Very good. Any comments from the Department of Finance? Comments from LAO? Questions from members of the committee? The recommendation here again is to approve, and so we'll take a motion on that item at the appropriate time. Anyone from the public who wishes to testify on this item? Seeing none, issue 3, vocational nurse education.
Okay, moving on to issue 3, Mr. Chair. This issue pertains to the Health Professions Education Foundation, also a very long-standing OSHPD program. This foundation, in contrast to the Workforce Division, primarily supports individuals who are either providing or are receiving undergoing educational opportunities to serve in the healthcare professions. And Lupe Alonso Diaz is the Executive Director of the foundation, and she will provide more detail.
Very good.
Thank you, Dr. Carlisle. The Vocational Nurse Education Fund is funded by a $5 licensing fee, and it was created in order to address the nursing shortage. The Employment Development Department estimates that there will be a shortage of 22,900 vocational nurses by 2014. Our current budget authority allows us to award approximately 15 to 20 awards annually. For each award, whether it's a scholarship or loan repayment, individuals are expected to, they're contractually obligated to serve 2 years in a medically underserved area. This request would increase our authority by 40,000, and it would result in an additional 10 to 14 awards.
Okay. Comments from the Department of Finance?
Yes, just wanted to note that there are adequate reserves in the fund to support the request without having any impact to the fees.
Okay, so our overview of the OSHPED budget on page 10 of our analysis indicates that the medically underserved account, the proposed budget for the entire account is $2.861 million. Is that what you're alluding to with regard to reserves, or is it a separate?
I'm sorry,
account?
were you referring to the medically underserved account?
That's
is a
different from
separate
this?
account.
That's different from this.
The account would be under the Vocational Nurse Education Fund.
All right. Any comments from the LAO? Any questions from members of the committee? Anyone in the public wishing to testify on this item? Seeing none, let's go to issue number 4. And let's ask the sergeant if they could please call the absent members and let them know that the committee is a hair's breadth away from shutting down, and we would like to have the members here so we could actually vote on these items. Sir.
Hello.
Joining us is Ron Spingarn. Ron is our Healthcare Information Division Deputy Director. And this issue pertains to legislation, special session legislation affecting the Committee for the Protection of Human Subjects, and would expand the role of that committee with regard to research application reviews.
Very good.
So SB X52, which was passed last year, was an education reform bill, and its intent was to increase access to data for students. It amended the Information Practices Act, and it changed the terms of who was eligible, which entities were eligible for data, from nonprofit educational institutions to nonprofit entities. So there was a larger pool of eligible organizations that could request our data. And the Committee to Protect Human Subjects receives those reviews from those organizations. They function as the institutional review board for the agency, Health and Human Services Agency, and our information division screens the specific requests for data that come to OSHPED for our confidential data. So we would project a workload increase as a result of this change, and are asking for the authority to redirect 2 existing positions within our current funding authority and fill those positions for a limited term to handle that workload.
Okay, but isn't this also, I'm on issue 4, right? Is that where I am? Where am I? Thank you. Isn't the issue here also that the legislation, unfortunately and perhaps, well, not perhaps, unintentionally expanded the access to information beyond just educational information, which was the intention, but to include patient information, which is normally kept private, and allowed by statute that information be made available to nonprofit entities. So we also need to fix that with trailer bill language that amends what was previously enacted to make clear that we're not going to be sharing patient information with nonprofits, and to narrow the scope to education information. Do I have that right?
Yes.
Okay. But in addition, you're seeking authority for 2 people to do the work that was intended in the legislation, which is the education information.
No. The way that the bill was written,
right.
The law is now, these nonprofit entities do have access if they were to request access to our data, and we would have to consider those entities, and not necessarily give them the data, but consider them. They would be eligible to receive it. So if you do trailer bill language and go back to the way it was, then it addresses this issue.
All right. So I guess I don't know. I mean, I'm not sure why we would authorize people, if we're going to adopt the trailer bill language, to say don't give the information out. So I'm inclined to, I want to talk to the other committee members, but I think the recommendation is we would deny the request for the additional funding and just adopt the trailer bill language that says, hey, we're narrowing this thing so that it's only education information. You're not giving out this other information that we didn't intend for you to give out, and then you don't need the people. Okay, does the Department of Finance wish to comment?
We would just agree with that. If the trailer bill language is approved to reduce the, to do away with the workload, then the department would not need those positions. So they were specifically only if there was additional workload caused from the original bill.
All right, very good. LAO?
Thank you, Mr. Chair. Meredith Worden with the Legislative Analyst's Office. If it was not the intent of the legislature to have this apply to health data, we have no concerns with the staff recommendation.
Okay, yeah, I don't think we want to be giving health data out. So, not patient data, that's for sure, in an education-related matter. So, any comments from members of the public? Anyone wishing to testify from the public? Questions from members of the committee? So we're asking the sergeants to call the absent members. I had one other question that kind of is not identified as an issue, but is occasioned by looking at the OSHPD budget. So the largest increase in your budget for next year seems to be related to the hospital building fund. By my calculation, it's about $4.7 million.
Yes.
And then the California Health Data and Planning Fund, which by my calculation is about $2 million. Both of those are special fund sourced.
That's correct.
So they don't have a negative impact on the general fund, which is good news. In fact, in your budget, your general fund reliance is going down in 2010-11, which is also good news. But I'm wondering if you could just give us an overview as to what's driving those two funds increase in your overall budget while we wait for the other committee members to show up.
Well, the major when we talk about the building fund, that is the fund that supports our facilities development division, and the major impetus for the increase in the fund is to really accelerate and improve efficiencies in hospital plan review, especially as we really are drawing to the close of the seismic safety deadlines for hospitals in the state of California. And so we are seeking to increase the size of our staffing to address seismic safety review and plan review activities.
Okay, and all of that is fee funded by fees on the hospital community?
That's correct. When hospitals submit plans for our review, they do pay essentially an application fee at the time of plan submission, and the fee is fully paid at the time of the issuance of the building permit.
Okay, great. And then the California Health Data and Planning Fund is about an increase of $2 million in that budget.
That is a special fund. Hospitals are assessed against their gross operating expenditures. The maximum fee is 0.036% of gross operating expenditures. Hospitals and skilled nursing facilities and ambulatory surgery centers also pay into that fund. That fund is assessed annually against those facilities, and is to support our data activities, including the MIRCAL program.
Okay, very good. Any other questions from members of the committee? Okay, so we're waiting. We understand that Mr. Bell is on the way, I believe, and that would give us 3. Oh, Mr. Nastandi. Good. Well, we'll take a brief pause in the action while we wait for these gentlemen to come, and hopefully they'll be here in the next 3 or 4 minutes, and then we can take some actions.
Thank you very much.
Thank you very much. Appreciate your presentation. Could the sergeant call Mr. Nastandi's office and tell him that we're just waiting for him and then we can vote? Okay, we're putting out a call again for Mr. Chespro, Mr. Nastandi, or Mr. Latore. We understand Mr. Chespro is chairing a committee, but we hope that Mr. Nastandi or Mr. Latore can attend this hearing so we can shut down. Excellent. Welcome, sir. I'm going to ask that the Secretary of the Committee call the roll, establish quorum, and then we'll begin voting.
Jones.
Here.
Bell. Here. Chesbro. Dillatore. Emerson. Here. Nastandi. Here.
Okay, we have a quorum. We're going to start with item 4120. The first action item under that item is issue number 1, Emergency Medical Technician 2010 project. There's a motion for Mr. Emerson, a second for Mr. Bell to approve the request. Let's call the roll.
Jones.
Aye.
Bell.
Aye.
Chesbro. Dillatore. Emerson.
Aye.
Nastandi.
Issue number 2, the workload for paramedic licensing activities and fee adjustment. The recommendation is a motion from Mr. Emerson, a second from Mr. Bell. Let's call the roll.
Jones.
Aye.
Bell.
Aye.
Chesbro. Dillatore. Emerson.
Aye.
Nastandi.
Okay, on issue 3, the recommendation is we're going to keep this item open and revisit it. They may revise once we get additional information from the preferred vendor. I don't know that we need a motion on that, Mr. Vice Chair. I think we'll just keep it open with your permission. Item number 4, the federal reimbursements for the California Poison Control System. We look for chair looks for a motion to approve that item. It's a motion for Mr. Emerson, a second for Mr. Bell. Any further discussion on the committee? Let's call the roll. This is issue 4. The motion is to approve.
Jones.
Aye.
Bell.
Aye.
Chesbro. Dillatore. Emerson.
Aye.
Nastandi.
Okay, that item is approved. Now we're going to move to item number 4140, issue 1, Medical Information Reporting System. We're looking for a motion to approve, a motion from Mr. Emerson, a second from Mr. Bell to approve the item. Let's call the roll.
Jones.
Aye.
Bell.
Aye.
Chesbro. Dillatore. Emerson.
Aye.
Nastandi.
That item is approved. Issue 2, the Song Brown Program General Fund Support. We're looking for a motion. Motion for Mr. Emerson, second for Mr. Bell. The motion is to approve. Let's call the roll.
Jones.
Aye.
Bell.
Aye.
Chesbro. Dillatore. Emerson.
Aye.
Nastandi.
Aye.
That item is approved. Issue number 3, Vocational Nurse Education Fund. We're looking for a motion. Motion for Mr. Emerson, a second for Mr. Bell. The motion is to approve. Let's call the roll.
Jones.
Aye.
Bell.
Aye.
Chesbro. Dillatore. Emerson.
Aye.
Nastandi.
Okay, that item is approved. Issue 4, Staffing for Healthcare Data Requests. The chair looks for a motion to deny the request and adopt placeholder trailer bill language to narrow the provisions in SB X52 to its intended purpose. There's a motion from Mr. Emerson, a second from Mr. Bell. Any further discussion by members of the committee? Let's call the roll.
Jones.
Aye.
Bell.
Aye.
Chesbro. Dillatore. Emerson.
Aye.
Nastandi.
That item is denied, and a direction to adopt placeholder trailer language is approved. With that, we're concluded. Thank you very much, members. Appreciate it. With this, the committee's adjourned.